morning, everyone. My name is João Andrade. I'm the CEO and co-founder of WideCells Group PLC. And today I'll be showing you how WideCells Group is revolutionizing the healthcare industry, but also how we are going to monetize that revolution. Well, first of all, we are a mission-driven company, and our mission is to make stem cell treatments accessible and affordable globally. Today, there's around 4 million people all over the world that have paid around £2,000 to freeze their baby's umbilical cord blood stem cells to protect their families against future illnesses. And they freeze the stem cells for periods of up to 30 years. Now, there's around 250,000 new collections a year at the current rate, and a cost of stem cell treatments can go as high as £300,000. Basically, what this means, as a summary of the current problem, is there are 4 million people paying £2,000 to freeze their baby's umbilical cord blood to protect their family, but the vast majority is unaware about the treatment costs, which means they pay to protect, but when they need to use it, the private health insurance today and not national healthcare systems will not cover for the cost of treatment. And there's 82 diseases today as routine treatments using umbilical cord blood stem cells to treat blood diseases and disorders, such as leukemia, lymphoma, myeloma, and others. Now, over the past 12 years, there has been a 300% increase in terms of diseases that can be treated using umbilical cord blood stem cells. And this shows that the rate of growth in terms of cord blood utilization for the future. Now, I've often seen the stem cell industry being labeled as a niche industry, but the industry is worth $100 billion today, and it's projected to grow to $170 billion by 2020. So the industry is growing very rapidly, and it's the segment within the healthcare industry that is growing faster. Now, there are certain markets, and particularly for stem cell banking, which is a segment of the whole stem cell industry, such as Latin America and also India and some countries in the Asia Pacific that are growing at astonishing rates. One of them is South America, where we already have operations. So what is the master plan to solve this big problem? Well, first of all, we've established a division that's called Wide Academy. And Wide Academy is where we provide accurate scientific and medical information to medical professionals, but also to potential clients, which are basically expecting parents that face the decision of whether they should or should not store their baby's umbilical cord blood when the baby is born. Now, it's very important that medical professionals understand the benefits of stem cell technology so that they're able to recommend or prescribe stem cell storage services and stem cell treatment in the future. There's an argument that most doctors have not been taught in stem cell technology in medical schools. So if expecting parents are asking their obstetrician, should I store my stem cells? It's very difficult for them to give a straight answer and to be able to recommend or prescribe. So one of the things we're doing into Wide Academy is condensing masters or PhDs into digestible courseware that a doctor can take up to 20 hours, for example, and he can get accreditation from top universities such as University of Westminster or University of Manchester, and they're looking to work with Cambridge, Oxford, MIT, Harvard, and so on. So they can get proper accreditation on stem cell technology, be empowered with knowledge, and then recommend the services. Now, the other division we've established is our own laboratory facility, which is we've set up over the past 14 months in the University of Manchester Innovation Center. So we completed our IPO in July last year, and one of the use of proceeds was to set up this facility. Well, normally it costs around £2 to £2.5 million to set up a stem cell bank. We've done that for £465,000. And you ask, how did we do that? Well, we had an assumption that if we could find a stem cell research company that was inside the university, that was conducting stem cell research and had the clean room facilities available, we could, basically if they were leaving the building, instead of incurring all the dilapidation costs and so on, we could take on the lease, go inside, do some upgrading work, equip the lab, and have a state-of-the-art facility. And we've now completed that assumption. We receive license even to conduct research. So we have the ability to store the stem cells at our laboratory in Manchester, covering Europe, Middle East, and some countries in the Far East, as long as we can get a stem cell sample from the hospital to our laboratory in under 72 hours, and normally it takes, from Dubai, it will take 48 hours, for example, we can process the stem cells from any of these countries, which basically means we don't need to open other laboratory facilities in other regions. Now, what really makes a difference in our product offering is CellPlan, because we have developed the world's first stem cell insurance plan to cover all the costs associated with stem cell treatment. So now families that have paid to store stem cells, those 4 million families, now have the ability to purchase an insurance policy that converts a potential £300,000 bill into an insurance policy that costs £170 per annum for the whole family. So 3 divisions, and with the 3 divisions we have global reach, because CellPlan we have no geographical barriers. We have an insurance model that allows us to go into any country in the world. And these 4 million clients are spread all across the world. And we have global reinsurance capacity as well. We have a clear path to increasing our revenues, which I'm going to explain it later on. And we have a no-star team to execute the business plan. So today we're revenue generative. We started to generate revenues 2 months ago. We are listed on the main board of the London Stock Exchange for a number of reasons which I'm happy to discuss with you when we're having drinks outside. And we're again focusing on making stem cell treatments accessible and affordable globally. We've been nominated or ranked 21st most disruptive company globally by Disrupt 100, which has little institutions sitting behind them, such as Microsoft, Google Ventures, Apple, Uber, amongst others. We've been Manchester Power of the Business this year and nominated for Life Sciences IPO last year. So who is the team to deliver this business plan? Well, I've been working in the stem cell banking industry for about 10 years now. I was fortunate to be involved in the industry at its early beginnings to identify its biggest problems. And in 2012, Lopez and I set ourselves in a journey to resolve these problems. So we have been building our products, going through licensing, fundraising, getting the teams together, and now we started to generate revenues. Lopez has been, during 25 years, area manager for Merck Pharmaceuticals in Portugal, managing a company with 60 million turnover, hundreds of employees, and hundreds of products. So he brings the skill set from the pharmaceutical industry into an industry that needed more professionalism. Now we have, as our Chief Scientific Officer, and we are all full-time, Dr. Peter Hollands is one of the top 10 stem cell specialists in the world. He was trained in Cambridge, where he took his PhD in stem cell biology. He was oriented by Professor Bob Edwards, the Nobel laureate that invented IVF. Peter was his right arm, and that research in IVF led to the initial studies in stem cells in the early 80s. So Peter has been involved in stem cell transplantation, teaching at Cambridge and Manchester, and that's why we're in Manchester. And he's also been involved in setting up corporate banks all over the world. We have David Bridgeland, vastly experienced CFO. He's over here in the second row, and he'll be available for questions later on. He's been involved with publicly listed companies and some big companies before. And we have Alan Greenberg, which is the former director of Apple Education, who is spearheading our education division. Alan's team at Apple built something that we're all very familiar with, which is podcasting technology, which is a spin-off from the University of Lyon, technology developed by Apple, and Alan was leading that team. He also built the iTunes U app for Apple, which is the app for academia, and the Distinguished Educators Program for Apple. So all of that is sort of a benchmark for what we are trying to effect in the stem cell industry as well. So that's where I say we have a brilliant team to execute the plan. We have Dr. Melanie Orsherton, founder of Denplan in the UK, revolutionized the whole dental industry by making dental treatments affordable. And she has helped us a lot in terms of product development for CellPlan. And we have Dr. Graham Hine, our chairman, who is a very successful entrepreneur. So corporate snapshots. We started trading at 11p last year. We're trading now at around 14p. As our shareholders, we have, for example, Miton Group with Gervais Williams topping up his position in the 2 private placings we did this year, small placings, to his maximum, which is 9.9%, so very supportive. Amongst the board, we have around 40%. We've seed angel investors, we have more than 50, and we have around 25% free floats. Bear in mind, we started to generate revenues now. So what we told the markets in our prospectus, we have delivered above and beyond all of that, and now we have started to generate revenue. So we're in a sort of an inflection point. Very briefly, stem cell technology. Why would a family store their baby's umbilical cord blood? Well, first of all, stem cell technology is not new. It's been around as routine treatments and adopted as a routine treatment since the 70s. So you might have heard of a bone marrow transplant. A bone marrow transplant is a transplant of stem cells following high-dose chemotherapy for cancer. Now, doctors in the 80s found another source of stem cells, which is a baby's umbilical cord blood. So effectively, a cord blood transplant competes against a bone marrow transplant. So what is the difference between the two? Well, for a bone marrow transplant, we need a perfect match, which means 100% match between donor and recipient. And that's why often you see families and patients struggling to find a matching donor. And most patients end up dying because they cannot find one. Now, however, with umbilical cord blood stem cells, we can have a transplant up to a 50% mismatch. And normally we find within family members of the nuclear family circle around 25 to 50% match, which means basically that if the family can afford to pay £2,000 when the baby is born to freeze the stem cells for 30 years, if any of the family members in the future develop a condition that can be treated with stem cells, which are mainly very, rare diseases, but very complicated diseases, life-threatening, such as leukemia, they have a resource they can tap into. So that is the big difference between cord blood stem cells and bone marrow stem cells. So we have a big solution here with this type of technology. There are other sources, for example, dental pulp, milk teeth contains stem cells that can be used in regenerative medicine. Adipose tissue contains, or fats following a liposuction procedure, contains stem cells, again, can be used to regenerate skin, muscle, cartilage, connective tissue, amongst other types of tissues as well. So we have a focused strategy, which is, first of all, to unlock the true potential of stem cell technology by making it accessible and affordable. We provide an end-to-end services solution. We drive innovation and funding going into research, because then we have an output. People can actually afford the transplant with our insurance policy, and we can deliver multiple revenue streams. So how can we do that? Let's go division by division, and starting with WideCells. So we've established our state-of-the-art facility in the University of Manchester Innovation Centre. And basically the product that we are looking to start offering now in January is for families in the UK having the ability to store their baby's umbilical cord blood with us in our facility. We already have our technology implemented in São Paulo, Brazil, where we are already generating revenues. From here, again, we can operate into any country in Europe, Middle East, or Northern Africa. What's our suite of products? We have baby cells, which is stem cell storage of baby umbilical cord blood. We have a synthetic bone, which basically, if you extract a tooth today and you wait for 2 years, you'll suffer from what's called bone resorption. You'll lose bone in your jaw. So if the implantologist or periodontist wants to place the dental implants, he'll have to regrow the bone. Normally, he'll use a bone graft, which is a bovine solution, which carries risk of rejection or contamination. Our synthetic bone is purely synthetic, and what it does is a sort of a matrix that induces cell growth, and the bone grows again. We have a new bone formation. And in 4 months, with an optimized procedure, the implantologist can place a dental implant, and it's more cost-effective than using a bovine solution. Now, we are also generating revenue from contract and development research. Basically, what this means is we have a state-of-the-art facility, we have technical expertise, and some research companies are looking exactly for that. So they pay us to use our clean room space and to use our technical expertise. So we are basically capitalizing on the infrastructure that we have invested. Underdevelopment means not really underdevelopment. It means more that we are going through the licensing process to be able to store, process and store stem cells from milk teeth. So instead of having children sending the tooth to the tooth fairy, they can send it to our lab where we can process and store them for 30 years. And if the family needs to use them in the future, they have a resource they can tap into. Similarly to stem cells from adipose tissue, which is a service we call the lipocells. So revenue model. The prepaid storage, processing plus prepaid storage of up to 30 years is around £2,000. That's the average price for Europe. We are targeting 5,000 clients in the first 3 years, and this yields a margin of around 60 to 70%. Now, in terms of research, we can take on board around 2-3 projects a year. We have, for example, contract research with a company from California that came all the way through the Atlantic to work with us, where we're generating already £100,000 on that contract. We have Indus, it costs £70, so it has a 200% to 300% growth. And the retail price is £420 per dentist. And with that, they can treat 5 patients. And they will increase that 2 or 3 times on their bill to their client. CellPlan. So CellPlan is effectively 4 services included in one single product. So your experts consultation is where we provide access to the opinion of world-class doctors. Basically, we have built a stem cell panel composed of the best stem cell specialists in the world involved in cord blood transplantation. And we have the ability to review a patient's case regardless of where he is in the world. So let me give you an example. Imagine a family in Australia has, 5 years ago, paid to freeze their baby's umbilical cord blood. And now one of the family members have been diagnosed with a life-threatening disease that can be treated with umbilical cord blood stem cells. But they receive a diagnosis from their local treating physician that is normally aware about the treatments being done in the hospital or the home country. Now, the nature of the industry is treatments are spread all across the world. So you might have an approved treatment by the FDA in the US or an approved cell therapy in Japan, for example. So we need to have a centralized point of information so that the patient can know the options. There's only one way of doing that, which is getting the best medical minds together involved in transplantation. And when we have a case, we can feed that information over to them, and they will provide, with your medical certainty, the right diagnosis and treatment plan. With your global resource, we provide a selection of treatment centers where the patient can access treatment. So we might tell this family in Australia they can receive treatment at the Great Ormond Street Hospital or the MD Anderson in the US. But they'll still face a huge medical bill, which can cost £300,000. And your family protection is an insurance policy that provides cover of travel, medical, and accommodation bills up to €1 million, dollars or pounds, and it's completely underwritten by a reinsurer, major reinsurer from Switzerland, which means we carry no risk whatsoever. And this policy costs £170 per annum. Now, 4 services which I mentioned, it starts at 150, that's before taxes, go up to £300. And this is offered in conjunction with a leading medical advisory company from the US, which helps us with the expert medical opinion service. And we have already started to enter agreements with cord blood banks. So basically the business model is the following. We have 4 million people storing stem cells in 500 cord blood banks. And what we do is we know exactly where the clients are who pay to store the stem cells are uninsured. They are in the cord blood banks. So what we do is we team up with the cord blood banks, and for all new clients, they include the first-year policy. And that's what happens with these 3 cord blood banks, one in the UK, one in Spain, one in Brazil. So all new families become insured. But they introduce the product to the existing database. So imagine they have 100,000 clients uninsured. They introduce the product to them, and they're incentivized by a commission. And so they're incentivized, we pay them a commission on the first-year policy plus yearly renewals, which means they develop recurrent revenue for the future. And our model is based on recurrent revenue. Now, we also developed an e-commerce platform as a way of helping distribution. And through our e-commerce platform, we are able to generate a quote, to conduct a health questionnaire, collect payments, and issue the insurance policy digitally, all in a very seamless process. Revenue model, on the right, £170. We are targeting 100,000 clients in the first 3 years. And bear in mind, there's 4 million globally. And we generate £50 per each insurance policy sold, plus yearly renewals. Now imagine this. If the family is storing the stem cells for 30 years, because they want to access treatment if they need it in the future, and if we have an affordable insurance policy, they'll most likely keep renewing it for 30 years. So even if we calculate a net present value on that client lifetime value of 50%, which is a bit aggressive, we can have a very valuable business just with the insurance policy alone, because one client might be worth £500, each client we bring on board. Now, Wide Academy started with an idea of educating the markets, no propaganda, no marketing. It's purely when doctors want to know information about stem cell technology, they could go into our platform and get all the information they want. If they want to get accredited and access specific courseware, they can do it as well. But we found a way to monetize it when Alan, that came from Apple Education, joined us. And because he's one of the top 5 names in education technology, he found a way to monetize his vision and make it profitable. And we are already generating revenues from it, which I'm going to explain in 3 simple slides. So the first thing is we are launching the platform beginning of next year. The platform is powered by artificial intelligence and machine learning, which basically means if you're a hematologist and you're asking, how many patients have received treatment for anemia of Fanconi? Instead of Googling it, which will get the result of whoever is paying more, you will receive the accurate information you need and you're looking for. Now, if he sees that 10,000 patients have been treated, now, okay, bring me results in the UK. And now I go on to dig deep into the research. And we believe we've built one of the biggest stem cell repositories of stem cell information in the world, with articles and scientific publications. And the platform feeds from all that information. So it's a brilliant way of providing the right information to doctors. It's a thought leadership program, let's call it. If doctors trust us, it's much more easy for them to then recommend and prescribe our services. Now, the 3 revenue streams. First of them is we have a partner now. We did a major announcement 2 weeks ago, where we have a partner in the Middle East and the Asia-Pac region, where they want to offer the stem cell storage services in the region by becoming our agents, and they also want to introduce the insurance policy in the Middle East and in Asia, where they have privileged contacts within the insurance industry. Now, what they thought is, we think the best way to go in the market and get support from doctors and the governments is to sponsor doctors to get accredited for stem cell technology, providing them the right information. If they are empowered with knowledge, they can then recommend the services. So they are paying us, they are sponsoring 2,000 doctors in the region at £120, which basically is the amount a doctor needs to pay to access our platform. But they are paying for that already. So we started to generate revenues from sponsorship, and this is recurring over the next 2 years. Now, courseware and accreditation, the courseware is free to wear. But if the doctor wants to get accredited, he needs to pay £200 per module, and then he gets the accreditation. So this deal we signed can represent up to £3.5 million directly from our partners. So we started to generate considerable revenue just from the Wide Academy division on top of everything else that we're doing. Global reach, I'll go straight into I'm conscious of the time. Global reach, with all our products, we have no geographical barriers. And we have a business model that allows us to scale up really, really quickly. Now, commercial partnerships, I mentioned already some of them in the Middle East and also in the US. Looking ahead, what we can look at, it's marketing and distribution of our products. We built all of them. We have license for 90% of our products at the moment, and it's just rolling out the products in more and more countries. So as summary of the investment case, we're innovative, award-winning. We have it's a revenue-generating company already. We have an all-star team to execute the plan, and we can quickly scale the business. This is just an appendix. Thank you very much.
We have time for just one question, I'm afraid, we're eating into time. Anybody got any questions at all? Gentlemen, just... there's two, just... Go on then.
30 years is a long time. Will premiums go up in that time? And also, what is the success rate in converting stem cells into appropriate use?
Well, first of all, it is already the routine treatment. Always following high-dose chemotherapy for cancer. To rebuild the immune system, you need stem cells. Either used from bone marrow, or now you have this technology which is using a baby's umbilical cord blood. The success rates using umbilical cord blood are much higher than bone marrow because they have a better ability to adapt to the body of the recipient. Whilst with bone marrow stem cells, that's why you need a perfect match. So sometimes the body rejects the stem cells that have been transplanted. In terms of increase of the premium, we are talking about mainly today, it's 82 diseases. There are blood diseases and disorders, all of them very rare. So it's sort of a catastrophe insurance. We don't expect many claims, but if you have a claim, it can cost 200 or 300,000 pounds. And in the insurance model that we build with the actuaries from the reinsurer, in fact, it's the other way around. The problem is in the first 2, 3, 4 years, we might not have that many claims. And in our reinsurance treaty, we also agree to have claims in the first 2, 3 years because we want to have testimonials to show people. Because as we are growing the database of clients, the likelihood of having transplants increase. So the increase in premium in the current diseases, it's almost inexisting. It will perhaps grow with inflation and so on. 30 years is a very long time for us to predict anything. But if there are treatments in regenerative medicine, or things like autism, cerebral palsy, multiple sclerosis, we will have an add-on. If the policyholder wants, he pays another 40, 50 pounds, and he can have access to that technology as well.
Thank you very much indeed. Thanks,
Thank you.
Thank you.